is David Beasley. I am a dentist locally I'm right on Verona Avenue, and probably, as I've been talking with some of you, probably everybody's heard, I'm right next door to the barber shop there, right down from the mobile station. So, and I opened that office back in 2013, and that was just open the doors, and it's been amazing to see how this community has supported me, and so I've just been really fortunate, and my office has grown, and we've gone from just 3 of us there to now 6 of us, and 2 hygienists that are very busy, and it's just been wonderful, and word of mouth growth has just been everything for us. So we've really loved our spot. What else can I tell you? I've been a dentist since 2007. That's when I came out of dental school. I've worked several different places in the Madison area before I started. So, like I said, Barb Walker had kind of started this process of getting me here, and they told me today that I could have had a screen, but we don't need screens, right? We'll go with just pictures and words, so we're good. So let's talk dentistry. Probably when a lot of you think about dentistry, the first thing that comes to mind is, I would expect, dental cavities, fillings. Those are the kinds of things that, particularly in our early years, are the parts of life where we tend to see the dentist when we have a cavity, when we have something go wrong there. Some of those may have turned into crowns over the years and things like that. And it is one of the major dental diseases that dentists do treat and prevent. But there's another dental disease that, until more recently, and when I say recently, the history of dentistry goes back a ways, more within the last 50 years, we've started to appreciate how important periodontal disease is. And that's, gum disease is another term that might be used for that. And I imagine that at some point, all of you have had either a friend or a relative who at some point noticed some of their teeth getting loose. And maybe they ended up being able to solve that through treatment, or maybe they lost their teeth and ended up with dentures. And for a lot of those cases, the source of that damage was periodontal disease. And so what is periodontal disease? Basically, if you can imagine it, and this is where pictures come in, and I brought 3 of them, and I'll just kind of try to get them distributed down there a little bit, and maybe hold one up so I can kind of point to it. So I know it's a small picture, but so periodontal disease, basically, if you can imagine a tooth here, and you have the bone, and that's represented by this structure here. There's a little ligament space around the tooth, that's these little lines running through here. And then the gums, right here. If you can imagine then, when bacteria find their way underneath the gums, and that's something that can occur gradually, it can occur more rapidly, and what happens basically is you figure those same bacteria that colonize the tops of our teeth that we're trying to brush off, sometimes will find their way up underneath the gums. And that's why a lot of you probably go in for regular dental cleanings, because you're trying to get, that there's deposits that are finding their way in areas that we can't reach with floss or with our brush bristles. And that's where a hygienist comes in. They can get underneath there and clean that off. So when that bacteria finds its way underneath there, it starts off as that soft film that we're all familiar with, the plaque, the biofilm. Over time, though, if it's allowed to remain there, it calcifies. It grabs mineral content from the salivary components, and over time, it becomes very firmly attached to the root surface, so right in here. What we know then is, and this is different for different people, I've seen folks who have had calculus underneath their gums for a long time and have pretty minimal disease, but we're all different. We all have different inflammatory mediators. So the way that our body responds to an insult like that is different. And so some people might, you've probably all run into somebody who says something to the effect of, I've never had my teeth cleaned and I've never had a lick of problems. And there are individuals who can do that. And it's rare, but it does happen. And what it is for most of those individuals is the calculus is there, the bacteria is there. There is some level of inflammation going on, but it's not causing the destruction that some other individuals will see from periodontal disease. Over time, what happens for most people, if they do end up with bacteria, what we call tartar or calculus, connected to the side of the roots underneath the gums in what we call the periodontal pocket, those bacteria are releasing toxins, and those toxins are causing the body to react. And so really what causes the damage is not the bacteria themselves, it is the body's reaction to the bacteria. So the body reacts, it causes inflammation in the pocket. Over time, what you'll see in the first bit is some bright red gums, inflamed gums, bleeding when you floss, things like that. Then over time, we'll actually see destruction of bone. And so the problem with the disease is it's self-propagating. So if you can imagine, if the bacteria are here, well, we can maybe get a chance of getting them cleaned out. But if we destroy bone, and now the bacteria are down here, there's no way a brush bristle is going to reach that or floss. And so it's a process that kind of self-reinforces over time because of the way that it works, the destruction of the bone. Let me see where I am. I went off script here. The bacteria that are associated with periodontal disease are very different than the bacteria that cause cavities. And the big difference is that they are anaerobes, which means they thrive in areas that have less oxygen. Well, a deep little pocket around a tooth, it's a perfect spot for them. And the deeper it gets, the less oxygen is present, and the happier those bacteria are. I could toss out some names: Porphyromonas gingivalis, Porphyromonas intermedia. They're bacteria types. And they are gram-negative anaerobes, which just basically means they love to be down in that deep cave of that periodontal pocket. And so we know that. And so what we want to make sure we do is try to disrupt those bacteria. And so that's what the idea of a dental cleaning is. Sometimes when those pockets get deep enough, we're beyond the point where we can do a dental cleaning that gets those out comfortably. And that's when we talk about a deep cleaning or scaling and root planing. And maybe some of you have experienced that, I don't know. But in that case, someone needs to be numb for it because it wouldn't feel nice to try to get it off otherwise. But what we know is the presence of those bacteria, when they are down there, when those collections, those deposits of bacteria are underneath the gums, they do cause inflammation, chronic inflammation of the body, which can lead to varying amounts of bone loss. Some people lose a lot of bone, some people lose just a little bit of bone. Some people eventually lose their teeth to periodontal disease because so much bone is lost around the tooth that they'll just all of a sudden notice mobility. One of the really unusual and difficult things about this disease is that most people don't feel it until it's really progressed a long ways. And that's why probably when you've been at your dental cleanings, you've noticed the hygienist usually goes around with a little probe. It's basically a little millimeter ruler, and they're just checking the depth of those pockets. 3 millimeters is pretty normal. 4 millimeters is getting a little concerning. 5, 6, 7, 8, 9. We're starting to get into those situations where the long-term health of the tooth is being really compromised by that loss of bone. So that's just a quick synopsis of periodontal disease. It wasn't that quick, but so basically then to review, the bacteria find their way underneath the gums. They start in what's called a plaque, a biofilm. That biofilm calcifies, grabs up mineral content, adheres itself to the tooth really tightly, so you end up with a really hard little piece of material down there. What I sometimes will describe as just a bacterial house, because that's pretty much what it is. These bacteria form a structure around themselves to protect them, and so the only way to disrupt that once those have formed is to have somebody with specialized tools, specialized skills, i.e. a dental hygienist, and get underneath there and pop those deposits off. What we'll tend to see in those situations when those deposits are removed is a decrease in that inflammation. That often will take that gum, let's say this is the tooth and this is the gum, that gum that's been puffy up like this kind of relaxes back down a little bit, reduces that inflammation, that reduces the depth of that pocket and makes it a less advantageous environment for those anaerobic bacteria we were talking about, those bacteria that love places without oxygen. So we've talked about periodontal disease, which catches our attention, but what I wanted to spend a little bit of time talking about today is how periodontal disease has also been linked to heart disease. Not only heart disease, but diabetes, Alzheimer's, all sorts of things that are in that same class. I think the more that we see research come out around these classes of diseases, the more we start to recognize that chronic inflammation is a concern for our bodies. Whether that's in our mouth, whether that's in our stomach, whether that's wherever it is in our bodies, chronic inflammation is an issue. And so we're starting to see a lot of lines drawn between some of these diseases, diabetes, heart disease, periodontal disease. What I want to start off by saying is, I'm not here to tell you that gum disease causes heart disease, because the evidence is not out there that supports that strongly enough yet. So I don't want this to be a, gum disease causes heart disease, come in and see me and get your teeth cleaned. I don't want you to take that message away, okay? The message I want you to hear is chronic inflammation in diseases like periodontal disease is linked with the inflammation that causes heart disease and that causes diabetes, or is related to diabetes, is related to Alzheimer's. And so we're starting to see this systemic connection with gum disease and the rest of our body. Let's talk about cardiovascular disease. According to the World Health Organization, it's the leading cause of death worldwide, and that also corresponds to, it's the leading cause of death in the US. Now, in the US, it's become, because of our great treatment modalities and because of the preventive treatments that are out there, we're seeing cancer rates are starting to get real close to competing with cardiovascular death rates. I would imagine for a lot of you, your parents and their generation, a lot of them died much younger, and that had a lot to do with untreated cardiovascular disease, and because that, for a lot of folks, that was the cause of death. And so it used to far outstrip cancers and other death rates in the U.S., but we do have the benefit of some really great healthcare in the U.S. And so we've seen those rates drop, but it still represents the largest killer in the U.S. is cardiovascular disease. Cardiovascular disease is caused by a process called atherosclerosis. It's a disease process in which plaque builds up inside the arteries. That plaque is made up of fat and cholesterol and calcium. And research is starting to demonstrate that those plaques often contain bacteria as well. Over time, the plaque hardens and narrows the arteries, so it hardens with those calcium products. So it sounds familiar, doesn't it? When you start to see some correlations there, it was kind of the same story here. Bacteria, body's reaction to bacteria, formation of hard plaques, turning into hardened plaques, which then in the mouth we call calculus. And so there's definitely some correlations here. Once those hardened plaques are in place, they restrict the blood flow, and that can lead to reduced blood flow to the oxygen-rich blood to the areas that need it. It can lead to heart attacks, strokes, high blood pressure, and just the whole gamut. And so, cardiovascular disease is a strong concern. So then what is the evidence for the link? It started to build probably about 15 to 20 years ago that we started seeing these links. And as research continues to roll out, that link becomes stronger and stronger. Now we talk about the difference between an association and a cause. Periodontal disease has not been shown to be a cause of heart disease, but we've seen a strong association between the two. So could that be that they have shared risk factors, smoking, diabetes? Certainly, there are shared risk factors between the two. And so that's always the thing that we're trying to sleuth out is this actually feeding into and causing heart disease, or do they just share a lot of risk factors? So we're seeing, but let's get to the data. Data says that individuals with active periodontal disease are 25% more likely to suffer from cardiovascular disease. So that's significant. Could it be shared risk factors? Certainly. Would it maybe be prudent to treat the periodontal disease as well? Probably. The other bit is that some research has demonstrated that the more severe the periodontal disease is, the greater likelihood that these individuals will suffer from cardiovascular disease. So some pretty strong causal links that have been developed through the research over these last 20 years. So we can establish the causal relationship because the common risk factors, those would include smoking, diabetes, obesity, all can both be all three be risk factors for both periodontal disease and cardiovascular disease. So, but there's this clear, strong association. And so when researchers have tried to establish mechanisms, reasons that there might be this strong causal relationship, three things have kind of stood out. First of all, the systemic inflammatory or immune response to periodontal infection. So if you have the periodontal infection, it causes a systemic inflammation. We start seeing things show up in the bloodstream elsewhere, showing an increase in inflammation in the body, just in relationship to periodontal disease. So that could be increasing our cardiovascular risk. We know that the more inflammation is in the blood vessels, the more likely that we start to develop cardiovascular disease. So that's one possible mechanism to explain the association. Another one is that pathogens from the mouth, we know that they have access to the bloodstream, and so those pathogens could be entering the plaques that are already present, and the research does show that that promotes an inflammatory immune response within that plaque, and then could make those plaques continue to expand and grow. We've even seen some evidence that those bacteria could be related to dislodging of the plaques, causing strokes and other untoward events, pulmonary embolism. To back that research, to back that statement, as research has been looking at those plaques, they've been finding those bacteria, the same bacteria that we find in the mouth, in periodontal disease, are being found in those plaques in the arteries. And so there's enough correlation between them that we start to wonder, okay, what's going on here? And then finally, in animal models, so I don't know whether it was beagles or what they were using, but beagles are kind of a classic one. In animals with atherosclerotic plaques, when those plaques were injected with P. gingivalis, which is one of those primary bacteria that's found in the periodontal disease process, those plaques dramatically grew. And so we're seeing enough of these associations and enough evidence that it does make us pause and think, boy, we probably should be looking at our whole body, not ignoring our mouth, not ignoring anything else, and just being aware of it all. So, like I said, can I tell you that heart disease is caused by periodontal disease? Absolutely not. I can't do that with the research. But is there enough evidence indicating a direct link that I would say it's prudent to treat both diseases? Yeah, I think so. That's what I have for you today. I hope it gave you kind of just a broad sense. Clearly I didn't pull out whole research articles to read to you, which I think you probably are all appreciative of. Any questions about any of that?
Besides brushing, the mouthwash, it's like 20% alcohol.
Yeah.
So, okay, is that just so your breath smells better, or does it actually kill bacteria or something like that there, or whatever?
No, that's a great question. So brushing and flossing are kind of they're the core. So, those are the two pieces that we can't do without. As far as mouth rinses and all that sort of thing, I always recommend that they're great as what we call an adjunct, something to add on. So brushing and flossing are the critical pieces. What we know about most of our mouthwashes, that alcohol is bactericidal. It will kill bacteria. And so something like Listerine, the combination of the alcohol and all of the essential oils that are in there, they do kill bacteria. So they do have a positive effect. The alcohol is a little drying for the gums. That can be, some people will struggle with that a little bit. It can make the gums a little bit more, can create damage for the
Yeah,
gums.
but it's like, years ago, a lot of people used to chew snuff all the time and stuff. And a lot of guys would put a little brandy in it or something like
Right.
that there. But now they say, it causes cancer and stuff like that.
Yeah.
So.
So the snuff and other tobacco products,
They don't have cavities, they say, guys that. have
Oh, really?
snuff. That's what they say.
So
They
I've
just-
seen-
they
I've
just-
seen-
After 20 years, they don't have any teeth.
right. So I've seen folks who are oral tobacco users who do end up with cavities. And what we do see is with oral tobacco use is changes in the gums. So you'll see loss of gum tissue. You'll see the tissues will change. They'll have what we call a corrugated cardboard appearance. So they, instead of being nice and smooth, the tissue wherever you're holding that oral tobacco will have these ridges running through it. Oral tobacco, sorry.
Back in the 50s, when the dentist didn't have hygienists and stuff like that,
Yeah.
one dentist told me he'd only charge me half if I quit smoking,
Uh-huh.
because it was so hard to get the nicotine off,
The
stuff
stain.
like that there.
Yeah, and it's definitely, smoking is one of our, in periodontal disease, when we're talking about periodontal disease, not only is it the stain from the tar, and that's probably what your dentist was saying is, there's so much tar here that it takes me forever to clean this off. But probably if you were to see it, that same dentist today he'd tell you about the tar, that it takes a long time for him to clean it off. But he'd also be talking about the link between smoking and periodontal disease. So that same, basically what you figure is the nicotine in the cigarettes will actually restrict blood flow, and that will reduce the body's ability to fight the bacteria that then cause periodontal disease. Also, there's heat damage from it. So there's definitely a strong link between smoking and periodontal
Well, a while
disease.
back on President's Day, they said why George Washington didn't smile is because his bottom teeth were all rotten and stuff like that.
Yeah.
But okay, now you hear people say they gotta have a root canal. What's the deal on root canal?
Yeah, so
Why do they have to have that?
Yeah, so root canals are a different mechanism. I'll pull out the tooth here. It doesn't show, so root canals are less related to periodontal disease and more related to usually dental cavities. And so that would be if a cavity entered in from this upper area up here. And there's inside the tooth, there is a blood supply and a nerve supply. That's why your teeth feel cold when you have cold things. They feel warm because there is a nerve that comes up from the very bottom of this root, comes up through the inside and right up into this crown. So if a cavity reaches that nerve, or if you experience trauma or something like that, it can damage that nerve and blood supply coming into the tooth. That damage then can result in both dead tissue inside of the root, and sometimes that dead tissue will also be infected with bacteria if it comes in from a cavity. Once that happens, there's not a good way for the body to fight that. It becomes an area that, because that blood supply is now cut off, the immune cells can't get there. So the only way to solve that is what's called a root canal, which basically means the dentist is going to come down, or endodontist is going to come down through the center of that tooth, all the way to the tip of the root, clean out that chamber, that canal, of all that bacteria and dead tissue. Once it's cleaned up, they seal it all the way to the bottom. So you'll notice if you were to see an x-ray of a root canal, instead of having a dark area in the center here, that dark area representing that blood flow and nerve supply coming in there, there'll be a bright white line running down the center of the tooth. And what that represents is the filling material we use, which we purposefully want to show up on an x-ray so we can see it. And so we make sure that it does that. It's called gutta percha, and it has some things that, it's a rubber-based material, and it shows up on our x-rays.
And then this dentist in Mount Horeb advertises that he'll do a crown in one.
Sure.
So, okay, now, most of the time, you hear, you get a temporary crown, then you gotta come back. And
Yeah.
So what's the deal there? Why can't they just do it once and you're done?
Yeah. So what that is you figure there are some offices that are using a laboratory. That's actually my office. So I will prepare a tooth for a crown. I'll take an impression of it. I'll send that to the laboratory, and the laboratory will build me a crown. So then I do put a temporary crown on in the interim. The offices that are offering same-day crowns have usually some sort of a digital scanner. So they'll scan the tooth, scan the preparation that they've just completed, and then they actually have a milling unit right on site that they'll design the crown and it will be milled right on site and they can put the crown right on. So that's the primary difference. The first way that I talked about is the way that it's been done for a long time, you know, until very recently. And the other way is a more recent innovation. It's a significant cost to upgrade to that. And up until recently, there were some questions about the integrity of the scans and whether margins were as consistent as they would want to be. So it's something that I have not adopted yet, but will likely at some point.
Then when you have your teeth x-rayed, do they do one half and then the other half? To do, you know, when you first go and the first, you get your teeth x-rayed.
So it depends on the situation. In my office, we always just try to make the best decision per the individual for x-rays. So we, you know, there are some individuals that might need, might have a higher cavity rate, so they would definitely need x-rays once a year. There's some individuals that haven't had a cavity in 50 years, and they might not need x-rays every year. And so it's just kind of case-by-case basis.
You're concerned about the radiation and stuff like that there. so-
Absolutely.
Yeah.
Yeah, so trying to limit radiation is always one of the things. Any other questions?
I don't have a question, but I have a concern.
Certainly.
My mother had major tooth work done,
Yeah.
long time, well, she died 25 years ago.
Okay.
She, a couple of weeks after that, I don't know the details of what she had done. A couple of weeks after that, she died of a cerebral aneurysm. And so when I saw this topic, because I've been scared, I mean, I'm now thinking that that had a connection to her aneurysm.
Sure.
But maybe, from what you said, it was what happened before the work was done. It was maybe too far, the damage that was done was too far along.
Right.
Is that?
Yeah,
is that
and
what you're
really,
thinking?
when we're talking aneurysms, that one would demonstrate, you know, I'd put aneurysms a little bit less in this category, in that they have less to do with the plaques and more to do with weaknesses in the blood vessels.
Right.
And so I don't have as much of a link between that and this. Could there have been a link to the dental work? I could never say 100% no, but I don't think so. It wouldn't really, I can't really think through a possible link there. We know that, you know, aneurysms usually are a process over a long period of time, that the vessels get weaker and weaker until finally they rupture.
Yeah. Yeah.
And we hate to see that, obviously, but you know, it's not as related to these atherosclerotic plaques. And so I'm not sure I would be able to draw a direct causal link. What we do, you know, you probably have somebody in your life who has had a knee replacement or a hip replacement, something like that. And I don't know if you've heard from them, but they often will have to, for a couple of years, take antibiotics before they see the dentist. The idea being there, when we're cleaning that bacteria off your teeth, is it possible that a few of those loose bacteria are introduced into the bloodstream at that moment? Certainly.
That's interesting.
Is it also possible that they're released there when you brush your teeth? Yeah. So I mean, there's definitely. So we at this point, the recommendation from the orthopedists is that most people will have antibiotic coverage for 2 years after not full time, but just right before their dental visit, have antibiotic coverage just before their dental visit for 2 years. And that's just trying to reduce the risk of bacterial introduction into the bloodstream and potential infection of the joint.
What do you mean? I don't understand what you mean about 2 year. Are you talking about insurance?
No, I'm sorry. It's after a joint replacement is done.
Oh.
After the procedure, generally,
Oh.
most orthopedic surgeons are recommending about 2 years of
That
coverage.
people actually take antibiotics for 2 years after they have a knee replacement?
Not full-time, but just right before they come to the dentist. Because they're trying to reduce the risk of bacterial introduction into the bloodstream. That relationship is weakening and weakening. It used to be there was a whole host of heart conditions that were on that list as well, like prolapse and heart murmurs, and all that list has gotten smaller and smaller as that link between bacterial introduction during dental cleanings and heart issues or joint issues has really weakened as the research has come out. Yes.
What do you recommend for when it comes to dentures? Do you recommend the implant ones, or do you recommend the one that you use that glue stuff with?
Yeah, so it's different for everyone. I have patients in my office who've had dentures for 50 years and have really not felt the need for implants. Their dentures, they've figured out how to use them in the way that works for them. And for those individuals, I rarely say, well, let's fix what's not broken. So I just let them carry on. There are other individuals that have a lot of trouble with dentures, and there are things that we can do with implants. For instance, let's say someone has a pretty strong gag reflex. Well, a denture goes all the way back to the back of the roof of the mouth. For someone with a really strong gag reflex, that may not be a possibility. They might be really uncomfortable. Dental implants would allow us to cut out the center of that denture and anchor the denture on the implants. So things like that can be really beneficial for some individuals. Some individuals have so little bone left on their lower jaw that a denture on the lower just kind of floats there. It doesn't really have much to hold on to. For that individual, a couple implants up here to secure that denture down can be really beneficial. So again, it's sort of a case-by-case basis. Some people thrive and do great with just full dentures and no implants, but others really struggle, and so for them, implants can be a really nice option. Yes?
How about the ones that have things like cleft palates, hair lips, and stuff like that?
Sure.
Can that be done for them?
Yes. What I generally recommend for folks with more complex needs, like cleft palates and lips and such like that, is to see a prosthodontist. A lot of times they'll have a little bit more breadth of experience with some of those more developmental clefts and things like that. Because sometimes a denture could occupy some of that cleft space. Now it's a little harder. An upper denture particularly depends on suction to stay in place. And that suction is a lot harder in general with a cleft palate or a cleft lip, because there is that, it's just harder to create a seal. Yeah, harder to create that seal. Does that help?
Mm-hmm.
I'm going to take it.
I have a real quick
Okay.
comment.
Either one of you.
All these people that are living to be 100 and over 100,
Yeah.
I mean, there's a lot of them now.
Right.
Do most of these people have their teeth, or do you know?
It's a really, I have experience with, you all might have known Ernie Johnson.
Yes, we all know him.
Yeah, there was a man that kept a lot of his own teeth all the way through, and he was just amazing. I mean, you all probably, if you knew him, you know that he was amazing. But not everyone who lives to 100 gets to keep their teeth. It depends on how significant the disease processes were over time. So maybe you had a bunch of cavities when you were young, and those cavities turned into crowns and root canals, and then, or maybe somebody had periodontal disease, and their teeth eventually started getting loose, and they started losing teeth. In those cases, tooth loss can be a strong factor. One other thing that we see, you figure over a lifetime, there's some wear and tear, and that's just chewing. Some people have clenching or grinding habits, and so 100-year-old teeth have seen a few more nights and days, some acid exposure, some wear and tear from maybe clenching or grinding, and so is it more likely that a 100-year-old has lost their teeth than a 60-year-old? Yeah. Is it more likely than a 40-year-old? Yeah. But is it possible to hold on to teeth your whole life? Yeah. It is.
Mm-hmm.
But there's a lot of prevention that goes into that. So preventing the dental caries and the periodontal disease, as well as prevention in terms of clenching and grinding, because that can also be. I've had some patients over the years who've had very minimal experience of cavities and periodontal disease, but who've done so much grinding, and usually nighttime grinding is a big one, that they've done significant damage to their teeth, and then you experience either tooth loss or just areas that are now more prone to cavities because they've worn into the softer parts of the tooth that are more prone. So.
Do her teeth move more? I mean, do they keep moving?
So yeah, there tends to be some motion as we age. It's not defined. Everybody's a little bit different. It can be sometimes because we've lost a little bit of our bone around them. That can create a little bit more mobility. There's the old phrase, long in the tooth, right? Well, what that means is, for a lot of people as they age, they lost some bone, they lost some gum height, and the teeth looked longer. So long in the tooth, older, that was where that phrase came from. And so, and with less bone, we can experience more tooth movement. Some of that, there is just a natural increase in tooth movement just over time. A lot of times we'll see a little bit of the canines will get a little closer together, we'll see a little more crowding up front, things like that. And that's pretty normal. Some people who've gone through orthodontics might decide, well, I'm just gonna keep them in that place with some sort of retentive appliance, whether it's a little plastic tray or whether it's a wire that holds things in place.
Do you think you'll ever see where the government has free medical and free dental and stuff like that there?
I hope so.
With all of the paperwork, it would be a nightmare. You'd have to hire 2 people just to keep track of all the paperwork to get your money out of them.
My hope is if it ever did happen, that it would be really well administered, which I know is sometimes a challenge in government.
That's pie in the sky dreaming of free stuff.
Yeah.
The only thing is free is the air, and sometimes the air isn't safe to breathe.
Right. Yeah, nothing comes free, you're right.
Spoken by an old mailman.
Sure.
And I wanted to make sure I count your question back
I had a
there.
general question. Do animals who don't go to dentists, do they have teeth problems?
That's a great question. Yes. I had we had a Shih Tzu, a little, probably that breed. They have a big underbite, their lower jaws come forward, and they are very prone to periodontal disease. Now, animals in the wild are less so, dogs particularly, because in the wild, they're eating, like coyotes and wolves, they're eating pretty much meat and bones and veggies. They're having very little fermentable carbohydrates, so things that bacteria like to eat, and so they have less experience of things like periodontal disease. But pets, you probably, if you have a pet, you've probably at some point had your veterinarian say, things are looking a little rough in there, we better get her in for a cleaning. And I know my little Shih Tzu, we had him in for some cleanings. He lost some teeth which is a little embarrassing as a dentist, I have to tell you. I should have been taking better care of my dog's teeth. We have another dog now that I'm trying to be better about brushing, but it's hard to brush. They don't like it.
Good line.
But we do it anyway.
Yes, we try to do it anyway. So yeah, so definitely we see it in animals as well. We see very little dental caries in animals, and it's because they have much lower sugar in their diet and a lot less acid as well. We subject ourselves to all sorts of sugar and acid in our beverages and our desserts and our so
We can't change that.
yeah, we struggle, don't we? So dental caries, we don't see nearly as much in animals as in humans, but periodontal disease we still see, particularly in domesticated animals because of their diets. And then
Are there certain beverages that are more acidic
certainly.
that we should avoid? Or
Yes, for sure. So I'm going to start by this one because I get asked this question. I'm not taking your coffee away. I just can't do it.
It wouldn't work.
It wouldn't work anyway.
Yeah.
So coffee has, so when we talk about pH, lower pH is more acidic, higher pH is less acidic. So coffee does have a little bit lower pH. It's not quite neutral, it's a little lower, so it's a little more acidic. But it's not nearly as acidic as some of the other beverages that are more of a concern. That would be things like soda. And soda is kind of a double whammy because it's acid and sugar together. So the acid starts the breakdown of the enamel, the tooth structure, and then that can actually create places for bacteria to adhere, and then those bacteria then consume the sugar. And so I will tell you you've probably all heard of meth mouth or something like that. Methamphetamine addicts end up with teeth that just are completely destroyed, and it's because there's a high acidic component there. I've had a few people who come in that my first guess is that they're meth addicts. What I find out though is that they're a chronic Mountain Dew drinker, and so it's amazing to see, the damage that soda can do, particularly in someone who's not taking great care of their teeth. But so soda's a really big one. For some reason, Mountain Dew is way up there, but the colas are right there too.
But does it help to rinse your mouth if you drink
It does.
soda?
So what I usually recommend is if someone says, I just can't give up soda,
Yeah.
I just can't do it. What I always recommend is try to constrain it to meal times, because we know that during meal times our salivary flow is a lot better, and try to rinse out with water afterwards. I have some patients who say, well, every time I have a soda, I brush right away right afterwards. And that's actually not a great idea because that enamel is softened. And if you get in there with a brush right away, you're brushing away enamel. The same thing goes for if, I've had a few patients over the years who are, have just a lot of problems with vomiting, throwing up. And, the first thing you want to do is get in there and brush it all out of there. Well, you're brushing away enamel when you do that too. And so each acidic exposure, whether it's from our bodies through reflux or from vomiting or from dietary sources like sodas, each of those exposures, our best bet against to combat them is just a good rinse with water, trying to reduce the pH or try to neutralize that acid as much as we can.
What about after eating ice cream with all the sugar and ice cream?
With that, I would say a good rinse. That is less acidic, so you could brush pretty quickly after that, and that'd be okay. Just get the sugars off. I saw your hand too, sir.
Do you ever treat people that used to work in the carnival where the main diet is basically coffee, soda, everything but that good stuff?
Yeah. Have I treated some people, as you said, who've had some pretty significant problems? Yeah, for sure.
I have
Absolutely.
to tell you, my husband was a Mountain Dew drinker,
Yeah.
and he was on the road a lot, so I don't know how much he drank, but I knew that he drank plenty.
Yeah.
He was almost 87. He didn't have a cavity in that mouth. He did not have a cavity in that mouth until at least 80.
Yeah.
And, because we dropped our insurance about that time.
Right, and then of
Because
course the
nobody
cavities,
needed it.
yeah.
Anyways, that's when he had 3 cavities, and I think he had a root canal in
Yeah.
the next year.
Yeah.
But when he passed away, he had all his teeth.
Well,
Lucky guy.
and that's a great story. It doesn't necessarily illustrate what I'm trying to say.
I know, when you said Mountain Dew,
You're like, oh, yeah.
I
So-
never liked it, but he did.
So what we know is that each of us is a unique
Yeah.
individual.
Oh, absolutely.
And so all the things that we talk about today,
Uh,
like I said about periodontal disease, there are folks who have calculus all over their root surfaces and they've had no bone loss. And there are folks that have just a little bit of calculus who've lost a tremendous amount of bone. And so the way our body responds to the
I
things
think so.
that they're subjected
I think
to
so.
also plays a large role. And another piece may have been salivary flow is a big thing too. And some of you maybe, I don't know what, I know with medications, sometimes we'll, and just with aging, sometimes our mouths get drier. So I've had a lot of my patients say they wake up and it feels like a desert in the middle of the night. And so could it be possible that your husband just had a really excellent salivary flow
I don't know.
and that was combating the Mountain Dew? That could be. So it's just hard to
Yeah.
know.
Yeah.
Everybody's
Every
unique.
one- He never lost a tooth.
That's a very good thing.
I mean,
One lucky dude.
Yep, absolutely.
Is diet soda, is that any, it's no sugar, but it would still have
That's
the
the issue.
acid
Yeah.
stuff, is that true?
That's exactly right.
Right.
So it is really similar in acidity to regular soda. Can't remember, I think there are some diet sodas that are even a pinch more acidic than, because some of those alternative sugars have an acidity to them. And so, yes, it's still very acidic. Does not have the sugar, so at least we're not feeding the bacteria, but we're still damaging the enamel with it.
What is the name of that? Like when you look at the ingredients?
Yeah.
What is the chemical name or that's the acidic part?
So a lot of sodas will have like a citric acid or something like that. It depends on the soda, what they're using.
Well, is cola then less acid, is it a less acid than
No,
like Mountain Dew, which I
it's-
don't happen to drink?
Yeah, so cola's pretty acidic as well. Really, there's not, I couldn't pick out a soda for you that isn't. Because
Yeah.
part of what we love about soda is that zing, right? And part of that comes from the carbonation, which actually increases the acidity as well. But part of that also comes from that acid, and our tongues like that. We like the flavor, we like how it zings a little bit, it feels, active. So what I always tell my patients is I'm not asking you to just completely give up soda. What I'm saying is be aware of how you use it. So I have, construction workers over the years who have a bottle of Mountain Dew next to them all day long. And every 5 minutes, they take another sip. Well, what's that do? It keeps the pH in the mouth really low, makes it so that the saliva can never catch up and neutralize the acid. And so with that individual, I say, well, why don't you switch to cans? and that's a silly thing, right? But what that does is, with a bottle, you keep recapping it, you keep the carbonation in. It still remains palatable. If you crack open a can, do you want to drink out of that can again in an hour? Probably not. So you're much less likely just to sit there and sip. You're much more likely to just finish it, and then the body's allowed then to do what it does well, which is bring the saliva in, neutralize those acids. And really the best possible option would be to say, well, if you just constrain it to mealtime, and then try to limit it to once per day, that's even better. So, would I love to see everybody not drink soda? Sure. Do I think that's a pipe dream and it's probably not going to happen? Yes. And so I just try to give my patients strategies of, if you're going to continue to have the soda, let's do it in this way. Let's have it at mealtime. Let's not have it right before bed. Let's make sure we're not sipping all day long. All those kinds of
What
things.
about carbonated sparkling water?
Yeah.
Is that,
So there's been with this resurgence of people really enjoying those, that's really hit the research here recently. There's some evidence, so carbonic acid is produced by, we inject the carbon dioxide into the water, it mixes with the H2O, the water molecule, and does create some carbonic acid. The pH is not so significant that we are too worried about it. The research is not bearing out that it's having a real negative effect. And so for most people who are drinking the carbonated water at this point, my answer is, so far the research seems to indicate it's not too big of a deal. So I don't get too fussy about that one. Yes?
Are receding gum lines connected with any of the periodontal problems?
Absolutely. So there are so some receding gum lines are absolutely linked. When you see, for instance, when you see the bone level drop, usually the gums come with. And it's actually better that they do because it gives you more access to clean out the pocket. With periodontal disease, we'll generally see it dropping more uniformly throughout around the whole tooth. And so some people have recession that's pretty constrained just to the outsides, towards the cheek sides. For a lot of those individuals, that recession has more to do with either the way their bite hits together, or maybe a clenching or a grinding habit that they're doing. What'll happen, we call it a fraction. What'll happen is, as you put that force down on that tooth, some of it goes down straight down into the bone and transmits into the bone. but some of the lateral force can actually cause some flexion at the neck of the tooth and cause little microfractures there. It can also do a little damage to the bone of the, on the outside there. The bone is pretty thin along the cheek side of your teeth, and so we can see a little bone loss. When the bone loss occurs there, it's not related to periodontal disease, it's related to forces. And then we can see that the gums will often follow the bone down the sides of the teeth. So it depends on the individual. I have lots of patients with recession who are not suffering from periodontal disease, and I have some patients with periodontal disease who don't have much recession. And in those patients with periodontal disease who don't have recession, we actually want to almost create the recession, because removing the bacteria from those pockets will create a little bit of recession, because it'll reduce that inflammation in the gingiva, and the gingiva will come into a better relationship with the bone. Gingiva and bone, the crest of the gums and the bone should be about 2 to 3 millimeters apart. It's called biologic width, and that's just kind of a default position. As we lose bone, that can get 5, 6, 7 millimeters apart because of the inflammation in the gums and the bone loss. So removing the bacteria then allows the gums to get back into that 2 to 3 millimeter biologic width sort of relationship. Does that make sense? That's a lot of detail that I tossed out there.
Very good.
Thank you.
Thank you.
That was wonderful.
Well, I really appreciate you all and your
Yeah.
attention, and
Yeah.
really, looks like I had one more question, sorry.
What do you view when it comes to protein drinks and stuff like that, and, you know, the bodybuilders work up with energy drinks and all those waters they got down in the stores?
Yeah.
Those flavored waters.
So a lot of the energy drinks are pretty acidic. So even Gatorade, which, you know, athletes are all about, and, you know, I see a lot of athletes with some issues with cavities because they're such heavy Gatorade drinkers. The best wisdom I can offer is water is always going to be your best friend. You know, if it's not maybe the tastiest of our beverages, but it's always going to be the one that's going to be best for your teeth.
Well, what the flavored waters they got in stores now?
Yeah, so it all depends on what they're flavored with. So some of them are just carbonated and don't have much acid, and some are flavored with, you know, I think maybe some citric acid in there, or so it really depends on what flavor is in there. So some are really. I think we need to clear out, don't we? Maybe another.
No, okay.
Yeah.
Morning, Kathy.
So does that help? So it really depends on what they're flavored with. Generally, the just basic carbonated flavored waters are okay, but then there are some where there's added citric acid or added fake sugars, and usually the more stuff you add in to the water, the less positive it becomes.
And like lemon and lime, is that acidic?
It is acidic.
It is,
Yeah.
How about
So-
the protein drinks the bodybuilders use?
Yeah.
That I see in the like in the gyms.
Sure. Yeah.
What about the stuff like that?
You know, it depends on. It'd be very
Lot of
case
sugar.
very case by case. A lot of them have a good bit of sugar in them, and so it's hard to. You know, I'm sure there's got to be one out there that's just wonderful and has no sugar and no acid, but
Stays on the shelf.
I haven't found it yet. So in general, they're going to be a problem as well. But you know, rinsing with water after and things like that. Yes.
Way back when you were talking about mouthwash, there are alcohol-free mouthwashes. Do you recommend one over the other?
There's one that I won't recommend, and it's Crest Pro Health. I don't know if you've seen that one on the shelves. It's alcohol-free, which I like, but we see a lot of patients who, and it depends on the individual, and the Crest Pro Health people would be mad at me for saying this, but we see a lot of staining with it. So, you know, and it apparently.
I believe that's what I had.
Yeah, and so it depends on the individual, but
Crest
for,
Health.
yeah, and so for you, maybe it's not been a problem, but for other individuals, and I think it's salivary components that the Crest people were explaining it, that the stannous fluoride in it sometimes will interact with different people's saliva in a different way and create the staining. So in general, I don't recommend it just because I don't like people to have a rude surprise of why all of a sudden are my teeth turning dark. I've had a few patients over the years now, and actually my wife, who had that happen to her.
Really, from Crest?
Yeah, there's Crest Pro Health products. So it's just that one branch of their products, the Crest Pro Health. Not just the Crest in general, but the Pro Health products.
Well, I thought that was.
Pro Health was good.
Yeah, well, and so I'm not gonna say, if you're using it and it's doing just fine for you, then you're not prone to the staining. And so you're probably fine carrying on. But for a lot of people, I wouldn't recommend that, just because it's a rude surprise when you end up with staining on your front teeth and you're trying to figure out what's going on and what's changed. So that'd be the one I wouldn't recommend. Otherwise, Listerine alcohol-free would be a fine option. I don't.
Strong, that
It is
is so
strong. I try not to, product recommendation-wise, there's not a lot of differences between a lot of them. I mean, when I'm suggesting toothpaste, I usually say, pick a simple one. The ones that are whitening and da-da-da and da-da-da, da-da-da, we tend to see some issues with. So we have some people who will have a tissue reaction to them, and they'll actually start sloughing a little bit of their epithelium in reaction to some of the whitening agents, and even Colgate Total. I don't love that has that. It's the same antibacterial that you find in hand washes and that sort of thing. And I just think we're over-subjecting ourselves to some of those. So I don't recommend Colgate Total either, just because I don't like the idea of introducing more of those, antibiotic sort of things in us.
I have a toothpaste at home, and I'm wondering about, it's called Close-Up.
Yeah.
It's got, 4 different things in it.
Okay.
It got like a mouthwash, it's got a whitener,
Mm-hmm.
it's got a fluoride, and it's got that normal,
Yeah.
all in one.
Yeah. How does it work for you?
Not really working too well, but I don't know what you guys recommend.
So
or
in
something like
general,
that.
I have a couple options at my office. I have a really plain Crest that I give out. I'm trying to remember, I'm not sure what my team put in there for you all to try, but there are a couple different things. There's also there's some toothpaste, some toothbrushes, a little floss, I think, and then some Biotene rinses. Biotene is a pretty valuable thing for people who have dry mouth, and so medication related or just sometimes age related dry mouth. And so there's a couple of those samples to try as well if you want to try those out. But we tend to just provide a pretty basic Crest, or we also have one real natural one that's has kind of essential oils and some other things like that. That just is really basic. So I try to keep it really basic with toothpaste.
So
a little fluoride, something something to carry it in, not too abrasive, and really the whole goal of the toothpaste is just mild abrasive, and the rest is just making things taste better and a little fluoride, and that's pretty much it.
So if somebody had an emergency and they wanted to come and see you, they could call you up and you'd try to work them in or something
We
like
do
that?
that. We sure do. Yeah.
And your office is right around the corner from Mobile at 109 East Verona?
That's right. Yeah. Yeah.
What kind of insurances do you take?
Oh, that's what we should have had.
we take so we take most insurances. There are a couple that that have a closed network that we're not part of. We take most. We're in network for Delta Dental. There is, I think, Dean has a Medicare plan that is kind of attached to their.
Advantage.
Yeah, and so we're in network for the Dean Care plan. I'm trying to think what else, MetLife, just a smattering. And if you had any questions, you could give a call in, and Marcy up front would be really your best. I do more of the dentistry and less of the insurance, so. Brad, I saw you had a question.
Yeah, I know the dentist I went to, he'd take 5% off for cash.
Sure, yeah, we do that.
So, yeah, I think if you ask a lot of them, if you give it a check, they'll deduct 5%.
Yeah, that's usually what we
Because
do.
the credit card, I don't know what the credit card charges them and when they'll get their money out of the credit.
Right,
company.
yeah, there's a
So,
percentage there for sure.
I think, Like somebody told me, cash is king a long time ago, and I still believe it, but a lot of people walk
Oh,
around, they haven't
cash
got a
is the
dime in their
best.
pocket. All they got
Great
is
job, Doc.
plastic.
Thank you so much. I really
Thank you.
appreciate y'all
Thank
coming.
you.
Yeah, thank you.